If you have sore, aching feet, you are not alone. Something called plantar fasciitis is a top foot problem. It's when the connective tissue at the base of your foot gets tight. It makes it hard to walk, but there is help with surgery. Just a heads up, if you're a little squeamish about needles, you'll see one a little bit in this story. Tonight, we get an inside look at a surgery using radio frequency to fix feet.
Okay, so let's take a look here.
John During could barely walk.
It's hard to describe it. It's almost like there's a knife stuck in the bottom of your foot.
It turned out to be classic plantar fasciitis. That's when the tissue gets tight and painful.
And you said there were mornings that you would crawl out of bed.
Hey, I would crawl out of bed because I couldn't put any weight on the foot at all. And it was bad. It was really bad.
Every step came with shooting pain, and it got in the way of life for this swim coach.
It was very difficult. There were many times during practices and meets when I just had to sit down. I could not walk.
John tried stretching, resting, and physical therapy. Nothing worked until he tried Topaz surgery. It's bipolar radio frequency right in the foot. And this is video of the surgery. Doctors mark the spots, and then it's not pretty, but they insert a tiny needle and a wand with radio frequency. Orthopedic surgeon Dr. Philbin says it's very successful.
But the little needle goes in through the skin and allows this bipolar radio frequency, or this wand, to go in at different depths into the fascia, and what it does is it increases the blood supply and allows it to heal in that area.
Bottom line, this gets blood into the area to heal itself. It's outpatient surgery, takes about 5 minutes, and is covered by most insurance.
No pain whatsoever at all. Good.
And you can see on the bottom of John's foot where he had it done.
Well, that's great, John. I think you're doing terrific.
Now he's back on his feet.
I feel great. I really, really do. I can do just about anything I want to now. The only thing holding me back now is my age.
So what's recovery like? Well, after surgery, expect to be off your feet for about a week, then wearing a boot for a few more weeks. Should be back to normal in 6 weeks to 3 months. Now for a look at tonight's consumer headlines.